illnesses like diabetes and Alzheimer's. Scientists in Newcastle say they've managed to clone a human embryo in Britain for the first time, while a team in South Korea says it has produced genetically programmed stem cells. But a report in the British Medical Journal warns that premature use of the stem cells could lead to increased risk of diseases like CJD.
Wherever he is, whatever he's doing, diabetic Clive has to stop, test his blood and give himself an injection 4 times a day, every day. But diabetes is just one of a number of conditions which doctors think might be cured through human stem cell research.
I wasn't diabetic one time, and I would like to be the same person as I was before I had that and all the inconveniences of diabetes, even though I control myself quite well.
And this is where it all begins, the first image of the first cloned human embryo in Britain, produced by researchers at Newcastle University. This laboratory, one of only 2 in Britain to be granted a licence to produce embryos for stem cell research. But how will such cells lead to the promised medical breakthroughs? The first step, the DNA, the genetic information, is removed from a single egg. It's replaced with DNA from the patient. The cell grows into a clone embryo, an exact copy of the original donor. From that embryo, stem cells can be harvested. Stem cells are crucial because they can grow into any tissue, blood, bone or muscle. But being clones, they're a perfect match for the individual, offering potential cures for diseases like diabetes without problems of transplant rejection. In a trial in South Korea, doctors have already managed to produce stem cells that are a genetic match for 11 patients.
The excitement really is that this is the beginning of the process that we need to understand to bring these therapies into routine clinical practice, but it is only the beginning.
Some doctors are warning that using stem cell therapy too soon could put patients at risk of other serious illnesses, such as variant CJD, unless the sources are strictly monitored. Others believe this process is profoundly unethical. Producing the life-saving treatment also involves destroying the cloned embryo that was created. That, they say, is a fundamental dilemma. Ben Ando, BBC News.